Before I begin, I'd just like to thank especially Sarah Kahn for inviting me to speak here today. I'd also like to say that I'm sensitive to the fact that it's past lunchtime, and to say that I actually wiped out a paragraph just to get us there sooner. And finally, I'd just like to say today that we talk about patients all the time and all the medical stuff, but I'd also like to acknowledge the fact that we have care partners and caretakers here who have to go through the entire journey with us and who are stressed and challenged in their own ways. And I just want to applaud them and just say thank you very much. So I've been asked just to tell my story, and basically that's what I'm going to do from the last 9 years of my life. I realize I look a little old for my age, but today happens to be my second birthday. 2 years ago on this very date in 2017, I received my bone marrow transplant. 1 year ago to this date was my first post-transplant birthday, and with it came our hope of cure. A month later, I found out I was beginning my third relapse. 9 months after that, I co-facilitated my first CLL specific support group. And now, 2 years to the day, I find myself in front of all of you with the honor of telling my story. Near the end of 2010, at the age of 45, I began this sometimes crazy trek through my CLL world. Although it all began with a stage 4 SLL and a week on a beach in Mexico. I'd spent the better part of the fall in turtlenecks trying to cover my ever-enlarging lymph nodes. 2 biopsies later, I was told I had a form of non-Hodgkin's lymphoma. A few weeks afterwards, it was determined to be SLL. A week after that, my wife and kids, were in Mexico, and at the encouragement of my wife, I had a visit with a shaman. To our regret, I still needed to get FCR. Prior to the trip, we had our first appointment with a hematologist, the same one who I still happily see today, and a doctor who I have developed the most kind and collaborative relationship. After a dizzying hour of conversation that I vaguely remember, I believe the seeds of our relationship grew from my one question that turned out to be, in his view, the most important point of our conversation. Did I understand correctly that this was chronic? Chronic has a different feel. As a psychotherapist, I've worked with dozens of individuals with solid tumor cancers. And their mindset post-treatment and going for tests is to ensure it does not come back. Sorry? Oh, sure. No problems. My experience has been opposite. My tests and visits were to measure when it has returned. To my mind, our disease carries a very different psychology and a very different stress. After Mexico, I began what was described at the beginning of 2011 as the gold ribbon treatment, 6 cycles of FCR. Of course, these days, being unmutated, I wouldn't have received it, but at the time, it was basically the only option, so I don't think it was even relevant at that time. There was a rhythm to the cycles. It was a week of feeling increasingly horrible, culminating in the weekend in bed, unable to move due to overwhelming nausea and fatigue. Those were the days of soda crackers and ice chips. Then I would progressively get my strength back over the following 3 weeks, readying myself to do it all again. Moving through those 6 months, I had my head down and my game face on. I must admit to all of you, I fell apart after that. I don't quite recall how I heard about it, but I found a program at the local hospice called Picking Up the Pieces. And it turned out it was the answer for someone falling apart after a diagnosis. Trauma and grief ruin your map of meaning, throw you into crisis, but assembling it all back together is an opportunity for a more authentic person. Although I didn't know it at the moment, it was the beginning of my career change towards becoming a psychotherapist. Looking back, I'm reminded of a quote from Viktor Frankl, where when we are no longer able to change a situation, we are challenged to change ourselves. In the fall of 2014, I was working full-time, as well as busy completing my schooling as a psychotherapist, when we learned my counts were beginning to slowly rise again. I don't quite remember the date beyond the fact I know it was close to Halloween. Not like my initial diagnosis, where I can almost remember that one down to the minute. A few tests and a few weeks later, the confirmation came, almost 4 years to the day of my initial diagnosis. My SLL was rebranded CLL, as it was now in my peripheral blood. Then we heard the one thing we didn't want to hear. I had developed the 17p mutation. Things can always be worse. During this first relapse, it was the only time I've truly entered a period of watch and wait. For me, this has always been a chess game. understand my disease, understand the treatment landscape, and try to make the best choices so I could have as long of a life as possible. In that context, my logic was, the sooner I started my treatment, the sooner I would relapse, the shorter my life would be. So I pushed it out as far as I could until both my wife and hematologist finally said, enough's enough. After 8 months of watch and wait, I could barely get off the couch. I would say that it was like being on a riverbank with perhaps my toe in the water, while everyone else sailed past me. It was a dark and very lonely place. However, it was also a place that gave me some insight to those individuals I would eventually work with till the end of their life. I began a new targeted therapy drug, ibrutinib, and the change was almost instantaneous. We have video my wife took, and my very large nodes began to visibly shrink within a day or two. We celebrated, and soon afterwards I was off the bank and back into the river. Only afterwards could I acknowledge that I had left treatment for too long, and that in that realization was one of the most important lessons I've incorporated into my being, and as well as my practice. Fear often makes us make poor choices. Opportunity doesn't often wait until the perfect moment to present itself. It was the very next day after learning I had the 17p mutation that I received a call from a workshop program created by a couple of psychiatrists at PMH. There was an opening. Was I still interested in attending? So there I am, my mind already trying to process that not only was I relapsing, but now I had a mutation that had the words poor prognosis written after it in every piece of literature I read. I won't lie, I didn't want to go. It felt too close to reality, and I wasn't confident I could tolerate 2 full days of discussions around cancer. My challenge was that the workshop was a psychotherapeutic method to help advance cancer patients. Thankfully, my very smart wife saw it somewhat differently and viewed it as an opportunity to help both myself and others. As she often is adept at persuasion, she urged me to reconsider and to accept the spot. She would say it was the universe quietly trying to tell me something. And did it ever? What resonated most with me was the concept of holding 2 opposing thoughts at the same time. To understand and accept that you're going to die, and still endeavor to live every day with meaning. I have not only worked hard to impart that idea to those clients I've worked with, but I've ingrained that concept as best as I could into my own living. For that alone, I'm grateful I listened to her. But in addition, a couple of weeks later, the hospice I volunteer with asked me to create a support program for those individuals with no treatment options left to them. Over the next year, there of course were good things too. We traveled a bit, going to the Caribbean twice as well as San Francisco. We enjoyed being with each other and the time away from having active disease. I also created my advanced cancer group program and began working with some of the most courageous people I've met. It always felt like an honor that these dying individuals shared their experience with me. Some even tried to fix some of their lifelong challenges while dealing with the ending of their life. It was inspiring and incredibly meaningful work. But life got interrupted again when in November 2016, my counts again were beginning to rise, propelled by a set of resistant CLL cells. We were so disappointed. Many other patients have been fortunate enough to experience years of remission with ibrutinib, but it was not the case for me. Sometimes it's challenging not to begin feeling things might not work out so well for you. But that very next day, I had a session with one of my palliative care clients. She was a remarkable person. She was a couple of months away from the end of her life. She was only 43. She, of course, never knew I was relapsing, but she also never knew how unintentionally she had helped me and continues to help me feel fortunate. I didn't realize it at the time when I became a psychotherapist, but the work would actually help me transcend my own disease. As I said, things can always be worse. Soon after, in December, we went back to the Caribbean. We do love the ocean, and did our best to put aside the fact I was once again beginning to relapse. We tried to enjoy the week and were quite successful. In fact, I had the opportunity to actually use my cancer for good. I do that now and then. After being allotted a terrible room, I went to the front desk to complain and revealed my medical condition. We ended up with a room on the top floor looking out over the ocean. It's always important, but there is an urgency that arises when you are relapsing. We were present to each other as well as to every moment of that time together. Upon our return, we watched my white counts rise for another few weeks until mid-February, when at the 200s, it was decided it was time to switch treatments. I actually found out recently that I was the first person in Canada to have switched from ibrutinib to venetoclax. I think this says it all, that they learned from my experience how not to do it. Instead of transitioning while still on the drug, we stopped ibrutinib on a Friday and began venetoclax that Monday. A couple of days later, my counts were increasing and were close to 400. My cell integrity challenged and leaking fluids into my body, and my nodes expanding like a pan of Jiffy popcorn. I was a swollen, relapsing mess. It was at that point my hematologist suggested we actually might be in trouble. Melanie and I held each other and cried for a bit. Then I used one of my many tools I've learned over the years and brought myself out of the fight or flight response. Found the pharmacist and asked if we could bring in a secondary drug to combine with the targeted therapy they were ramping me up on. Although it didn't happen at the time, a month or two later, at my prompting, we decided to include rituximab in my treatment plan. What did happen was, at the time, was my hematologist, after consulting with PMH, decided we would defer from the protocol and increase the speed of the ramp-up process for venetoclax. That day I was admitted in the hospital was the first day ever that I was admitted since being diagnosed 6 years prior. My first week, I was barely conscious. It was Nelia, who was both present to my suffering and in fear for my demise. I think sometimes we forget how tough this is on our significant others and how much they endure emotionally. However, even in these moments, there is still room for growth, and it transformed her idea of how she would deal with my passing. As she had said since, that first week allowed her to understand deep in her soul that if by chance I did pass away, that eventually she would be okay. She didn't know when she would be okay, but she knew eventually she would. That understanding allowed her to remove fear from the situation, and in turn, allowed her to be even more present to my suffering. At the beginning of the second week, I was a little more conscious, certainly awake enough to understand when, after several days of the new treatment, things were beginning to work in our favor. So after 3 weeks, including a staph infection, I was finally released. When your body goes into such disequilibrium, it takes a while to recover, but I barely had a chance when the following week we were brought down to PMH to discuss an allogeneic bone marrow transplant. Usually I'm my own advocate, but after what I've been through, I was not up to the task, and in fact could barely process being back in a hospital, never mind the actual conversation. Nelia was my voice and defender that day, as she has many times when I've been too sick to, and I'm always grateful for her passion to defend me. No one cares about your life as much as you do, but there's no doubt she is a close second for me. Transplant was a concept we had discussed with my doctor since early on, and a topic we had desperately avoided. And now my healthcare team was thinking, due to the nature of my CLL, that this time was the way to move forward. In fact, it held out the potential for a cure. It was a swing for the fences, a frightening attempt at a home run. It was the most challenging choice we had to make since all this started. We reviewed the chessboard and decided to proceed. Although it was scheduled for September and against the protestations of my transplant team, I made a choice to push it off until November. In order to finish my combo therapy, to go spend a week by the ocean with my favorite person on this planet, my wife, and to celebrate our anniversary before I entered hospital. In addition, my advocacy had picked up steam during the summer when we found out the second drug, rituximab, we combined with venetoclax, there would not be covered by anyone, as I had had it during my first-line chemotherapy treatment with FCR. I spoke about it at another patient conference and gave the same speech at Queen's Park. It probably would not help us, but perhaps our efforts would help others. One other important thing, due to my delay, I wound up with a 10 out of 10 match instead of a 9 out of 10 scheduled for September. After preconditioning, it's chemotherapy and radiation, I was in PMH on the 14th floor for 5 weeks. Nelia beside me, having taken her short-term leave from her job to be there every day. We were actually amazed how they had the process down like clockwork. Almost to the day, what they said would happen happened. On November 16th, or day 0 in the BMT world, I received my transplant, which basically looked like a normal transfusion and was quite anticlimactic. The biggest thing I had to wrap my head around was that I now had a different blood type. And with it came the potential that my new immune system would wipe out my CLL. I was finally released in mid-December and back home. I cried when I stepped through the door, and no moment had it felt truer than that moment. There is no place like home. I was very weak, requiring a lot of assistance for the first while to take care of myself. I was also very isolated. With my immune system in the poor shape it was an especially scary world out there. I wore a mask out in public for several months and probably went through a gallon of disinfectant. Then in April, while attending a friend's party, I finally came out of isolation and for the first time left the house without a mask. After my strength came back, we began to get on with life again. I increasingly felt better, and for the first time in a while, I was not on any cancer drugs. It felt good. Although we have always maintained a realistic hope, it was hard not to get carried away with maybe this was it. Maybe we could finally breathe. On my first birthday, I was told I was still at full remission, but several weeks later, it all began to fall apart. My chimeric test, which is the ratio between my donor cells and my cells, fell from 97% donor to close to 50-50. It wasn't a good sign. Another bone marrow biopsy, and it dispelled any doubt. My CLL was rumbling back. Through conversations with the transplant team, we decided to do a top-up on the transplant in hopes it would create chronic GVHD, which is graft-versus-host disease, which in turn has a graft-versus-leukemia effect. The top-up is called a donor lymphocyte infusion, or DLI, and my donor almost didn't donate, but finally agreed. I had one infusion before I wound up in the hospital for an extended stay to get my CLL back under control. I went back on venetoclax, once again making history, as the first person in the world to go from venetoclax into a transplant, and then again from a transplant relapse and back onto venetoclax. Not the way I ever thought I would make any history. We managed to get things back under control, and I was released with more prescriptions than I've ever had. I take more than both my parents combined, and my mother is 78, my father 84. A second DLI followed shortly after, and I'll be honest, I'm not sure it was a blessing or a curse, as I finally developed GVHD. In the literature, it is often described as trading one disease for another, but it appears I was lucky, as I have seemingly maintained both diseases. The GVHD showed up on my skin, in my mouth, my tear ducts, and the worst in my lungs, where it has greatly affected my breathing, to the point just going up the stairs can be exhausting. It has left my body swollen, fluid around my heart and lungs, and 15 pounds heavier due to all the excess fluids. But my CLL is currently in remission, and we, my healthcare team and I, are already looking towards the next relapse and have our next two moves in place. It could always be worse. Because of the relapse, I have not been able to get my immunity shots, the ones you get as a kid. Yet I ventured out of the country to California once again against the advice of my doctors. My mask donned on the plane just to get certified to help run the CLL support group with my co-facilitator, Greg. And again, this summer, Nellie and I drove almost 5,000 kilometers on a tour of the East Coast. The trip, along with our time together, was precious. And although my illness weighed us down at times, we were both grateful after having just relapsed a few months earlier to share this adventure. Meaning can overcome one's circumstances. I believe it's that powerful. When all this began in 2010, it felt like something heavy and black had descended over our lives. The lightness was gone. But over the years, as we learned, adapted, transformed ourselves, we began creating cracks in that darkness. And that reminds me of a verse from a Leonard Cohen song. Ring the bells that still can ring, forget your perfect offering. There is a crack in everything. That's how the light gets in. I wish you all many cracks for the light to get in. Thank you.